How many in the group are parents of a child with autism in the group? A very large number. How many are therapists in the field? And do we have nurses and physicians in the audience at all? Do we have any? Yeah, yes. Okay, great. Okay, so I'm going to be talking primarily today about the nutritional supplementation in autism. And I'm just going to start to alert you, especially those who are parents, that there is going to be an outreach clinic available that's specifically dealing with autism, PDD, Asperger's, ADD, and the brochures are available at the Great Plains booth. And so to start with the divergent views of autism. So according to one viewpoint, that autism is a neurologic disorder due primarily to genetic causes, and the treatment is behavioral therapy and neuropharmacologic therapy. And then the second view, which has evolved as a part of the Feed Autism Now, which I was one of the founding members, is that autism is a systemic disorder, not just a brain disorder, but it's a systemic disorder in which brain function is also affected due to toxic exposure, nutritional deficiencies, in some cases vaccine overuse or vaccine abuse, gastrointestinal dysfunction, food allergies, and genetic vulnerabilities. So there's no doubt that genetics does play some role in autism. And, and over the last 10 years, there have been a wealth of new information about some of the genetic factors. And the treatment is directed to reduce or remove toxic chemicals, to restore nutritional balance, to put back beneficial bacteria into the intestinal tract, to remove foods that are not beneficial to the individual because the individual has a sensitivity or allergy. And it's very important that behavioral therapy also be done hand in hand to help to recover functions that may have been lost during the time that the child was ill. So these are some of the symptoms of autism and PDD, pervasive developmental disorder: a lack of speech, expressive and receptive, stereotypical or odd behavior, social deficits, hyperactivity and sometimes low activity, hypoactivity, poor focus and concentration, reduced pain and danger perception, poor eye contact. And of course, each one of these will be manifested differently in each child. And what I've done is go back through my experience now of about 15 years and kind of summarize how some of the abnormalities in autism can be associated with a particular factor, and realize that this is an approximation. And with so many factors, of course, there may be some degrees of overlap. For example, sleep disturbance can be due to melatonin deficiency, which has been documented in autism. Melatonin is a very safe nutritional supplement. And it can also be due to iron deficiency. Iron deficiency can be checked just by a simple blood test, the blood count and measuring serum iron. And treating that can greatly benefit the child who has sleep problems. Another common problem are children who experience eye pain. And children who are verbal, the children will verbalize that, "Mom, my eye hurts me." And there can be eye touching, eye poking, eye stimming. And frequently this is associated with calcium deficiency. And this can be very severe because some kids who have this really severe eye pain will actually pull out their own eyes. There have been 20 documented cases in which the children pulled out their own eyes. And I was on the podium when a parent got up after my presentation and said, "I wish I had heard this a week earlier." Her child had pulled out the eye the previous weekend. And he kept on saying, "My eye hurts me, my eye hurts me." And the child pulled out the eye. Luckily, the eye wasn't completely severed from its blood vessels and nerves. The eye was just lying on the cheek. And the mother brought the child to emergency room. They sewed the eye back into the head. And on the way back home, the child was trying to tear the bandages off so they could pull out the eye again. And she told me within about 2 days of giving calcium supplement, that abnormal behavior completely went away. So in a child with autism, calcium deficiency can cause severe eye pain. The symptoms of hyperactivity, excessive laughing, and stimming, two big things. And I see this almost every day in my own stepdaughter, and that is Candida problem. And it's a recurrent, difficult problem, and it doesn't go away easily, and many children with autism have to be treated for years. My friend, who's a psychiatrist, his son has been on nystatin for 20 years. So it is, so with the anti-candida treatment in autism is like having to give insulin to a person who's diabetic. If you give insulin for 1 week to a diabetic, they'll be good in that 1 week, but then they'll have problems if you discontinue. And for a large number of kids with autism, the candida is one of the most severe problems. Another problem which is extremely common in both autism and kids with attention deficit, either with or without hyperactivity, is lead toxicity. Lead toxicity is rampant throughout the world, and several papers have just come out, one of them from Canada, showing even small increases in normal levels, what are considered in the normal range of lead, can lead to severe depression. So even the smallest amount of lead can cause very abnormal behavior. Then the typical thing, being spaced out, lacking sensitivity to pain, children who crave high amounts of milk and wheat. The classic thing is the macaroni and cheese diet. This is associated with high amounts of opiate peptides that are derived from milk and wheat, that the children become physically addicted. And so that's why they don't feel pain. That's why they're spaced out, because they're zoning out. They're overdosed on their food opiates, just like morphine. Some children with autism have frequent urination. I mean, there are cases where the children go urinate 100 times a day, but only a very tiny amount, just a few thimblefuls. Or they may, if they're verbal, they may complain that they have pain during urination. And my own research has we've looked into that and found that lots of kids with autism have high amounts of oxalates, which are sharp, painful crystals that can accumulate in the urinary tract and cause this symptoms of frequent urination. Head banging or hand biting. This can be associated with severe gastrointestinal pain. So almost every symptom in autism